Type 1. This is the famous pellet poop. It comes out in small, hard pieces, almost like nuts. It usually takes a lot of effort to pass, and the person feels like they need to strain. This happens when the bowel is very sluggish, almost always due to lack of water and fiber. On top of that, the color tends to be darker, showing that the body is holding on to too much liquid. It's like a warning sign, hey, drink more water and take better care of your diet. Type 2. Here we already have more of a sausage shape, but with cracks and an irregular surface. Even though it looks more continuous, it's still hard to pass. This type shows that the intestine is starting to work, but not quite as it should. The cause is usually the same: poor hydration and a diet low in fiber. It's not as bad as type 1, but it's still a warning that something needs to improve. Type 3. This one is a bit easier. It also has a sausage-like shape, but with some cracks on the surface. Passing it is much easier compared to the previous types. It's a sign that the intestines are working better, though still not perfectly. The color is usually medium brown, and this format can already be considered acceptable. Type 4. This is the ideal type. The stool comes out shaped like a long snake or sausage, with a smooth, soft surface. It's a sign that the body is well hydrated, digestion is working as it should, and the diet is balanced. The color tends to be lighter brown, which reinforces that everything is on track. If your poop looks like this, congratulations, your gut is happy. Type 5. Here the stool is softer, in small, mushy pieces, but still with a defined outline. It's like a creamy mass, easy to pass. Although it's still considered within the normal range, it can suggest that the bowel is moving a little faster than it should. This may be related to not drinking enough fluids or a faster digestive process. Type 6. At this stage, the stool is very soft, almost pasty, with ragged edges. This is a warning that the body isn't absorbing water properly. The color can range from light brown to yellowish, and it's often linked to stress, poor diet, or even mild intestinal infections. If this happens frequently, it's worth paying attention. Type 7. This is the most concerning type: completely liquid stool, with no defined shape. In other words, diarrhea. At this point, the body loses water and minerals very quickly. The color may vary from yellow to greenish, depending on the cause. In these cases, it's important to hydrate well, and if the problem persists, seek medical advice, since it could be a sign of an infection or something more serious. Poop says a lot about our health. It can show when we're well hydrated, when we need more fiber, or even when we're too stressed. Changes like constipation or diarrhea aren't only connected to what we eat, but also to our emotions. Anxiety and nervousness can completely disrupt the gut. And pay attention. If these changes persist, they may indicate more serious issues, such as food intolerances, inflammation, or even colorectal cancer. That's why observing the shape, color, and frequency of your stool is such a simple way to take better care of your health.